friends, how are you doing today? I trust you're good. You're welcome back to Health Conference YouTube channel. Please, today I want us to talk about something really important. Please do not say this video is just for a lady, because of the truth it is not. It is for you, that guy watching it. It's for you, that man. This video can do a lot of good to your daughter. It can do a lot of good to your sister, your granddaughter, your mother, and every other lady around you. Okay, so I want us to talk about something really sensitive today, and that is pelvic inflammatory disease, PID. Now, what is PID? The Center for Disease Control and Prevention defines PID as an infection of the female reproductive organs. Yeah, it's a collection of a generalized infection of the pelvic organs of a woman, and this could result from untreated sexually transmitted infections. Yes, there are other infections that could result in PID, not only sexually transmitted. There are other infections that could result in PID, maybe from certain medical procedures like childbirth. You talk about insertion or placement of intrauterine device for contraception, and so many other things. But today we are going to look at the common causes of PID, and that is STIs such as chlamydia and gonorrhea. So we're just going to look at what is in PID, talking about the causes, the signs and symptoms, which are the indicators, the treatment, and how we can better still prevent it from ever occurring. Okay, let's go in now. Okay, now let's look at the indicators of PID. When do you know? How do you know you have a PID? When you see these signs, when you notice these signs and symptoms. Okay, in some cases the symptoms may not be very obvious. In some, there may not be any signs or symptoms at all. But should there be any, these are what to expect. These are typical signs and symptoms of PID. Number one, cramps. You feel serious pains around your pelvic region, that's the lower abdomen. You feel serious pain. And also you could experience bleeding in between periods, like you're supposed to have your menstrual, or you're supposed to start menstruating on the 15th of January, and it's coming already on the 1st. So you experience bleeding in between periods. Another thing is nausea and vomiting. You feel nauseated and you feel like throwing up. Another thing is fever with a temperature higher than 38 degrees Celsius. Another thing is painful sexual intercourse. You feel so much pain during sexual intercourse. You could also bleed during this. Another thing is a burning sensation while urinating. You feel pains and a burning sensation in your bladder while urinating. Now, these are the typical indicators of PID. When you feel these symptoms, then please go to the hospital. Don't wait for it to intensify. Don't say the pain is not severe. I had severe pains. When you feel this way, please visit the hospital. Okay, now so let's look at those risk factors for PID. Now, what are those things that put you at risk of getting a PID, contracting PID? Number one, you are likely to have PID if you're sexually active and age 25 or younger, because of course the people who are sexually active are the people that can easily contract this, because PID basically or majorly is contracted through sexually transmitted infections. The primary cause of PID is sexually transmitted infections. Okay, another thing is if you have multiple sex partners, if you have STIs that are not treated, if you have untreated STIs, if you have had a PUD before, that it can reoccur. You can also contract a PID if you douche. Yeah, for our ladies who use all these products. So if you use this product, not this product, sorry, if you douche with whichever product you use, you're more likely to contract a PID. Now, how does this work? Now, normally in the vagina, there are certain microorganisms that are called normal flora. The purpose of these organisms are not to harm the area but to protect it. So douching takes these microorganisms away from there. Yeah, it takes them away from there, and so they can't carry out their protective function, and any other microorganism can colonize the vagina. And of course, in PID, how does it happen? Once it gets into once it spreads to other reproductive organs, yes, there will be an infection, a generalized infection. So if you douche, you're more likely to contract PID. And also, if you've had an IUD, that's intrauterine device for contraception, placed before, you're likely to contract PID. And many other medical procedures, like if you've terminated a pregnancy before, of course, yeah, probably it wasn't done well. If you patronize quacks or whatever, even if it weren't quacks, wherever there was an exposure to infection, to a microorganism, you can go down with PID. Okay, so now how can we deal with PID? How do you treat PID? It starts with early diagnosis. You just can self-diagnose. You can tell yourself, I have PID. So whenever you experience the symptoms we have mentioned earlier, whenever you experience things like discharge from the vagina with a foul smell and all of this, please visit the hospital. Apart from, okay, like we mentioned, some symptoms are very subtle. They are not loud, they may not be obvious. Sometimes you don't even experience any symptoms. So every year it is advised that you go and get tested for chlamydia and other STIs. So and then from there, if there is a presence of any microorganism, of course you'll be diagnosed, it will be detected, and treatments will be initiated early enough. But that doesn't take away any harm that has been done if there's been any harm done to the reproductive organs already. But it starts with early diagnosis. So please make sure you go to the hospital if you experience any of the symptoms. Okay, another thing is, now from the hospital, that's where you get diagnosed, and then your doctor knows what to do for you. Trust me, I'm not going to make prescriptions because you have to be tested. Yes, you have to undergo some there has to be laboratory investigations to spot the the offending microorganism, and then appropriate measures will be taken to deal with that. So it starts with going to the hospital. And please, if you're going to the hospital, you just don't get treated alone and then go back to your sex partner. You go with your sex partner. And both of you have to undergo the test and go through the treatment protocol, because you can't go get treated and then go back to your partner. Probably you got it from your partner, or even if it was from you, probably your partner has contracted it. So if your partner doesn't get treated, it could recur. Even if you have been treated and you're well, if you go back to your partner and then you have sex, PID can come back to you. It can locate you again. So you get treated, and then whatever course of treatment is prescribed, you have to follow this course, and sometimes you feel better even before completing your antibiotics. But please, you don't need to stop. You have to take everything, you and your partner. And until you complete the treatment, please don't have sex, because if you do, you're going to cause more problems. Okay, so basically that is it. So you just visit your doctor, visit the hospital, and what you need to do will be told. You'll be told what to do, and you just follow it strictly, and you will be fine. Okay, so what happens if you do not get treated of PID? Yeah, we're talking about the complications. So with early diagnosis and treatment, you could prevent these complications. But without early diagnosis, with nothing being done, leaving an STI untreated, and then it gets to causing PID, and then still not treated, so many problems could occur. Number one, yeah, from that picture we could see the fallopian tube is blocked. And how did this come about? Now, an inflammation, PID being pelvic inflammatory disease, means there's an injury to the pelvic organs. Now, looking at the fallopian tube, there's an injury outside and within the fallopian tube caused by PID. Yes, this is what PID can result in. And this injury, trying to heal, at the spot of the injury forms scar tissues. These are tough tissues. to help to aid the healing process, and this can result in tubal blockage, because by the formation of the scar tissues, the place is narrowed, the spot is narrowed. It's no longer permissive, no longer patent as it used to be, as it originally used to be, but it becomes a little narrower than it was earlier, and this can result in blockage of the fallopian tube. And of course, this is one of the major problems, one of the major causes of infertility. Number 3, infertility. Yes, of course, infertility has PID to be one of its major causes. If you go to fertility clinics, you see a lot of cases in there with PID as the only cause of their infertility. Okay, number 4, pelvic pain. Chronic pelvic pain. There's chronic pelvic or abdominal pain because the pelvic organs are inflamed, and so whenever you touch the pelvic area, there will be tenderness. So the person suffers from pain that lasts for a very long time. Okay, so now how can we prevent this whole thing from ever happening? How can we prevent PID? So number 1, the CDC, that's the Center for Disease Control and Prevention, recommends that to reduce the chances of getting PID, every woman aged 25 or younger gets screened for STDs every year. And also, apart from those aged 25 and younger, for the older women now, those exposed to risk factors such as getting married to a new spouse or having a new sex partner should go get screened for STDs too. You and your partner go get screened for STDs. Another thing is maintaining a monogamous relationship with a partner that has been tested and has a negative result for STD. So you go get tested and you be sure you're free from STD, and then you maintain your relationship, because multiple sex partners is one of the major risk factors for PID. Another thing is the use of latex condom. Please get protected at every time you indulge in a sexual intercourse. Please use latex condom to protect yourself from contracting STDs. Okay, and also if you're pregnant, and because most of our ladies come down with unwanted pregnancies and they feel they should terminate that pregnancy, please don't do anything to your reproductive system without discussing with your doctor. Please visit your doctor. Do not patronize quacks, because most of them use instruments that are not well sterilized, and this can introduce infection. This can introduce a microorganism into your system. So please ensure you visit a hospital before doing anything. Do all you need to do based on the prescription of your doctor. A qualified health personnel. Okay, so with this, we've come to the end of this episode today. So please stay healthy. Stay healthy. Stay healthy. And if you've not subscribed to this channel, please subscribe to this channel to get fresh episodes every Friday. Thank you. See you next Friday. Bye-bye.